Hello. What's up, Sim Sim? Can you hear me? Sorry, I'm still trying. I'm adjusting this thing. I was pulling it kind of weird. Awesome. Here, do me a favor real quick and tell me if you can hear this. Can you hear somebody else talking, or do you just hear me? Okay, you don't hear anybody else or anything else talking? I don't know if it's this or that that's actually recording me. Okay, cool. I'm saying that because I'm actually listening to some videos and I don't want to like get copyrighted or anything for it. That's why. So thank you. It's going pretty good. I'm currently studying some neoplasia. So I'm watching pathoma videos and we're doing basically, I put it at a different angle, so it's going to be kind of weird for me to do weird stuff. But I'm watching pathoma videos on neoplasia right now, just taking notes, doing some, just like some solidifying of some material. I have been doing some crazy amount of Anki cards, and I think I actually activated too many, and I'm kind of on information overload. So I'm trying to like just consolidate some information by just watching some lectures without some heavy, crazy thinking right now. What's up, Triple OG? For surgeons or other family doctors, I think PAs have a really good spot right now, especially with the lack of primary care in the United States. I don't think they won't be able to overtake surgical careers. Those are strictly physician, doctor, MDDO positions. So I don't think they'll be able to take that, but I think they will be able to do a lot of primary care stuff. I'm not aware of PAs that are allowed to do surgery. Do you guys ever watch videos on 1x speed? I always put my videos at 1.5 or 2x speed, honestly, when I'm watching a video or a lecture. That's a dog barking. one time, but now I can do 1.5. Do you know anything about CT surgeon and how cardiology might be in the future? Will CT surgeons still be needed because of advancements in technology? I think CT surgeons, I think you're talking about the interventional radiology specialty probably. Yes, cardiologists are still going to be needed. There's a shortage of every position, so it doesn't really matter, I think. Um, yes, they're going to be needed because cardiovascular disease is crazy in the United States, and there's not going to be enough IR people to do it all. So yes, we're still going to need cardiologists and surgical cardiothoracic surgeons to do that stuff. The outcomes might not be as good, or I don't know how the outcomes compare with the interventional radiology versus cardio surgeons, but I'm sure um, it won't matter too much because we're going to be short on them. How's it going, Ahmad? School's going good. OG, just trying to really get crazy with my studying. I've been studying so much, guys. I really love getting good scores, so I've just been really trying to grind every moment I got when I'm not just relaxing and hanging out with my family, my sister, my girlfriend, or anybody like that. I just really been trying to grind, grind, grind. Um, Sometimes even when you're super tired, I still kept going because uh, I don't know. I feel like sometimes when you're super tired and you still push through, it just makes you recall it. I mean, I'm sure it's not as effective, of course, but just something about it makes me feel good about myself when I finish it, when I really didn't want to continue studying. In Healthcare Friday, I almost broke my back lifting and positioning people. Oof, I'm sorry, Ahmad. That sucks. What are you going to try to match into? What was your favorite rotation so far? I haven't done rotations yet, Ahmad. I'm still in my I'm a first year med student, so I haven't done any rotations yet. That doesn't come until third year actually. But I do hope to match into peds. That is actually what I want to match into. I want to do peds, and then I'm gonna have to do a fellowship to specialize in something. We'll see what that is. Not quite sure yet. I don't know if it's easier to match now because of people don't want the lifestyle. I think healthcare is shifting a little bit to a better lifestyle just because physicians, all healthcare workers are overworked, quite honestly. As you saw, Ahmad almost broke his back lifting and positioning people. People are very overworked in healthcare, the workers. So I actually wouldn't be surprised if it's easier, although I'm still sure it's extremely competitive. So I don't know. That I do not know. 'After that experience, I think CNA should make more. How much do CNAs make around, Ahmad? I don't know how much CNAs make. 8 to 12. Yeah, that is kind of low. What does it what does it take to be a CNA? Like, what's the how do you get a job as a CNA? I guess is what I'm asking. Oh, I see, Ahmad. How long is that CNA program? 2 years of clinicals. Is that after high school or during high school? How does that work, Ahmad? It's in 11th and 12th grade at the hospital. EG, EKG, CNA, phlebotomy, patient care technician, I imagine. Certified medical assistant. That's interesting. That's kind of cool though that your high school offers that. I think that would be very useful. I think just for students like graduating high school and then going straight into the workforce. That's kind of cool. I have something stuck in my teeth. It's 6th through 12th grade. Oh wow, so 6th through 12th you're doing it. So the first 4 years you're doing like just like preclinical information, and then the last 2 you're doing clinicals. Basic training for nursing skills and wearing proper protective equipment. How many Anka cards do you go through in one day, Aaron? I know it's a lot, but I'm curious. So I am actually, so at the beginning of the week, Sim, I still have some to finish today. Let me fire up my Anki real quick on my computer that I can give you an idea. I think the average, it says I've been doing around 260 a day, but that is over, let's see. So my daily average is 284 reviews. But I think that takes into account the whole last year. So I don't know. Here, let me do stats. Let me do the stats thing and then show you. Mm. Yeah, so it says I do an average of 288 cards right now, a day. And that's basically everything has compiled from week 1 of med school. I haven't deactivated any cards, so I still see musculoskeletal questions often. Today I have 660 left, and I have done 108 already. Yesterday I did 1,500, 1,502. The day before that I did 759, and then the day before that, when I hadn't activated anything, I was at 228. So the beginnings of my week really spike, and then as the week progresses, it goes down. And then once I start new material on Monday, it spikes again, and then it goes down. It's felt really good for me like that. I feel like I'm actually retaining a lot of information, and I really like that system. So it actually, I feel like I can usually get my Anki done in about 2 hours on a non-learning, like new weekday. Less than 2 hours is actually about how much time I spend. I've been spending a lot more, of course, last couple of days, but about a couple hours it takes me to get through my Anki. So yeah, I don't know if that kind of answers your question, kind of not. Yeah, I still have 660 to go today, but I'm gonna do those after I watch these videos. So I've already done the cards for these videos, but I've done so many cards over the past few days that I just want to do something else. So I'm gonna do um, the video because I read the book when I was on vacation, just so I would have seen it before I start the Anki cards because I like watching the videos before I see the cards, but I couldn't. So now I'm watching it. It's just a different week. Trying to make it work still. Oh shoot. Holy cow. Did you guys see that? My pencil got launched. Kyle, that's a huge amount of Anki cards. When you go to second year, will you be redoing older Anki cards from first year too, or will you hold that off for step 1 prep? So I'm going to try my best, Sim, to keep every single card activated from now until I take step 1. That's my goal. I don't know how many cards I'm going to have to be reviewing daily once I get into that second year before step 1, but I am going to try so freaking hard to get them done so I see it over and over and over. I actually set a limit for the longest a card can be pushed out is 4 months, I believe. And I did that because I was pushing cards out already like a year and a half. And I'm like, basically, I'd see it one more time. If I get it right again, then I'm just gonna see it that time before step. So I decided to put 4 months out. So even if I do get it right, I'm gonna see it again in 4 months, and it might add up too much. So I might have to extend it a little bit. Maybe I'll do like 5 months or something at that point. But we'll get to that. We'll cross that bridge when we get there, as a lot of people like to say. Let's see. Did I get a message on here? No. Do you think college is better than med school? No, I think med school is better than college. I don't know. I like med school more than college personally. Med school is harder, but at the same time, it's not because I'm doing everything I wanted to do. I'm in med school, and I don't know. It just feels like there's a lot of pressure off of me, even though there's a lot of pressure still on me. How's it going, Zanib? Just chilling, watching some Pathoma right now on cancer, basically, and hanging out with you guys, answering a few questions. Nothing crazy. No, med school is a little bit different than Abe. So we go in what are called blocks. So blocks are basically organ system blocks, and it doesn't go by semester or term really. Um, like the clinical morphology block was 8 or 9 weeks long, and then we finished, we take the final, and we're done. And then we started our second block, which was I don't even remember what the last block was. The names are so different now. Let's see. Then we started Molecular Foundations of Medicine, which was 4 weeks. And then we took the final and we're done. And now we're in Concepts in Pathology and Histology. This one is about 4 to 5 weeks as well. And then we'll be done in December, and that'll be the end of our year. So it's kind of different. We get a grade for each block specifically. And that's just kind of how med school is set up, I guess. I do have two monitors. I have you guys up on one screen right now so I can see the questions, and then I have my videos on this screen right now. When I'm watching professor lectures, I like to have the document open on one screen and then the lecture on open on the one that I can take notes and just have it twice, I guess. I don't know. Although sometimes it can be distracting, but for the most part, it's pretty useful. What I have found is bugs me is that my monitors aren't the same size, and that just kind of bugs me for some weird reason. I have to take out loans on Abe, so basically you just have to take as little money out as you can. Um, Obviously, just try to live within just modest means. Don't go crazy, and that way you won't have to pay as much later in the future. Um, that's just like, uh, yeah. Budgeting in medical school, basically, I just try to spend as little as I can every month. That way, I don't take as many loans, and that's basically my budgeting. Um, I think I had some pretty good money managing skills in college, so I didn't really have a problem with it, but it can be difficult for a lot of students. For me, like I don't really like to get extravagant stuff or anything, so it's not that big of a problem for me, honestly. I think my biggest expense is probably like when I eat out. I feel like eating out um adds up, and I think that's the biggest, like, I don't know, money sink, I guess. But you gotta eat, so you can't just not eat out. I try to eat in as much as I can, and I like to cook, so it's not really a problem, but it can be difficult. Like sometimes it is hard, like right now for Christmas, for gifts, like do I spend money that I don't actually have on gifts to give to people? And like, yeah, I want to buy gifts, so it's like a balance. Just be smart. I know it's easy to say, um, but that's my advice. I know, not that helpful. I actually didn't move out with my parents until I was 22. I commuted every single day to undergrad college. It sucked commuting, but I still lived with my parents the whole time. And I was kind of forced out um, when I got a job here in town. So that's kind of what happened around 22. And yeah, I wasn't that young compared to a lot of people. All right, one video down. That was the longest of them. That was 40 minutes. The next one is 20, and the next one's 28, and the next one's 20. The next one's 9, the next one's 20. Whew. 24. About to turn 25 in January. How would you describe me based on the live stream videos? I would describe you as, let's see. I would describe you as maybe younger than me. You're pretty inquisitive and curious, and you want to know like how the whole med school thing works. So I feel like you want to go to med school, but other than that, there's not much else I can imagine about you, I guess. Um, that's all I got. I think the hardest question being asked in an interview is like medical school is just like, why do you want to be a doctor? I think it's a question that you really have to like think about for yourself for a long time. Like, why do you want to be a doctor? I think that's why they ask it, because it's so important, and it's just so like it's so different to every single person, and it's so personal that it's hard in that sense. And also it's hard because it's always changing. Like there's like that initial want, and then as you go through medical school, or that as you see more patients, it like changes. So I think that's probably the hardest interview question behind like, I don't know. I just think that's pretty hard question, honestly. Um, and it's different for everybody, as it should be. Um, and even now, like it changed from the first time I applied to the second time I applied to now to last year. Like that's the hardest question for sure. All right, see you, Zaneem. Thanks for hanging out. All right, another one down. All right, guys, I'm gonna take off. I might be back later. Also, I'm gonna be doing a post soon on a Q&A for my girlfriend and I on what questions you want us to answer. And I'll put that in a post, so make sure to leave a comment. Hi, Debbie. Sorry you showed up late. I was just saying I'm gonna do a post I'm going to do a post soon. That's what I meant, not recently. On what questions you all want me and my girlfriend to answer. And make sure to leave a comment so that I have a good amount of questions so that we can make a video, because she actually said yes to making a video with me and she hates taking videos. So yeah. All right. Thanks, guys. Bye.